1 out of 5 women in India suffer from polycystic ovary syndrome. PCOS affects millions of women of reproductive age in India and is the leading cause of infertility. Hi, I'm Sania Mirza, and I take privilege to welcome Dr. Vijaya, a renowned health expert who will offer practical strategies to empower women in managing PCOS complications. Raising awareness about PCOS can greatly benefit women due to the numerous myths and misconceptions surrounding the condition. Doctor, can you enlighten us on how a balanced portion control meal can positively impact a PCOS patient?
Hi Sania, thank you for asking a good question. Polycystic ovarian syndrome is most common emerging problem these days in adolescent girls as well as in reproductive age females. Most of the times these patients present to the clinic with irregular periods and also with infertility. The most culprit of all these problems is obesity. So obesity leads to insulin resistance, which in turn will cause increased synthesis of testosterone levels, which will cause increased hair growth and also defective formation of egg, as well as sometimes it prevents the release of the egg, leading to infertility. So reducing the weight is the most important cornerstone of the treatment of polycystic ovarian syndrome. If the patient loses at least 7 to 10% of her body weight, that makes so many wonders in reducing these symptoms. So whenever a patient comes to the clinician, we should always tell the patient to take low calorie diet, which includes low carbohydrate diet as well as high protein diet, and decreasing the portion of the meal will help in the reduction of the weight, which will cause increasing the insulin sensitivity and also decreasing the testosterone synthesis, which will help in reduction of hair growth, etc.
Thanks, doctor. Can you also share how crucial is physical activity in the management of PCOS?
Very relevant question, Sania. So whenever a patient comes with all these symptoms, whatever I have told already, we advise the patient do regular activity, which in turn will help in the reduction of the weight. So the cascade of all these symptoms, which will lead to all these manifestations, will be reduced. So whatever exercise that brings pleasure to the patient, not with force, the patient is asked to do all exercises like Zumba, aerobics, yoga, anything that helps in the reduction of the weight will help reduction of all these symptoms. So we advise the patient do at least 40 minutes per day and also at least 150 minutes per week, 5 days. Exercise is advised to the patient to reduce the weight, to improve the insulin sensitivity.
Thanks, doctor. One more question. What are the important parameters to be regularly monitored in PCOS patients?
In PCOS patients?
Very good question, Sania. So whenever like polycystic ovarian syndrome, it affects adolescent girls, reproductive age group patients, and also postmenopausal women also are affected with polycystic ovarian syndrome. So in adolescent girls, these girls will have some sort of anxiety, depression because of obesity, hirsutism, and also irregular periods. So they are withdrawn from their peer group. We have to counsel these patients, and we have to give some moral support to these patients whenever they come to the clinician. And also in infertility patients, we have to regularly monitor whether the ovum is released or not by giving some medication like ovulation induction drugs. And also if the patient doesn't conceive with these only ovulation induction drugs, we can do IUI, or to the extent we can go up to the IVF treatment. And also in patients like postmenopausal patients, PCO can cause uterine cancer also. So totally these patients are at risk for cardiac diseases as well as diabetes mellitus, and also uterine cancer. So we have to focus at what parameter has to be checked whenever the patient comes to the clinic. We have to regularly monitor the weight and blood pressure and glucose monitoring has to be done regularly, and if needed D&C and regular monitoring of uterine endometrial thickness by using ultrasound. These precautions taken, even PCO patients can have a reduction of all these symptoms and they can lead normal life. Thank you, Sania, for making me part in this awareness program regarding polycystic ovarian syndrome.
Doctor, the clear message for all women is that meal, movement and monitoring are pivotal in managing PCOS for the benefit of women and society at large. Thank you, Dr. Vijaya, for your valuable insights which can be vital for effective management of PCOS. As an athlete myself, I recognize the importance of lifestyle management for a healthier tomorrow. Together, we can break the stigma, spread awareness, and support each other in this journey towards better health and well-being.